Hello. In this lecture, we will learn about mismatch negativity, a component that is one of the earliest cognitive responses in the structure of the event-related potential. Mismatch negativity can be seen as a neurophysiological marker of the orienting response to novelty, or the Pavlovian "what is it" reflex, which automatically shifts the focus of attention and alters our behavior. Anytime there is a violation of regularity in the sequence of habitual events, and among the same type of signals another signal appears that differs from them in some way, the brain's activity changes. The brain's response to the detected sensory changes can be seen within 200 milliseconds in the form of a negative deviation of potential. This is the mismatch negativity. The phenomenon of mismatch negativity was described in 1978 by Risto Nautanen, known for his work on the study of attention mechanisms. In his research, Nautanen used sound stimuli that differed slightly in pitch. Let's listen to what Risto Nautanen told in his lecture about it.
The mismatch negativity can be seen here. It's a kind of additional negativity which is elicited when a sound deviates from the preceding sounds. And we can get it more visible by subtracting this standard stimulus waveform from the deviant stimulus waveform. So these are of course average waves. So here, for instance, this is mismatch negativity for 2016. And you can see that at 2008 there is very little left, and for 2004 nothing.
So, as Risto Nautanen has just described, when registering mismatch negativity in the auditory modality, two types of stimuli are used: a standard stimulus such as a 1000 Hz tone, and a deviant stimulus, a higher frequency tone. The probability of stimulus presentation differs. The standard stimulus is presented much more often in 80% of the cases, the deviant stimulus much less often, only in 20% of the cases. The order of presentation is random, but the interval between stimuli must be constant. During the presentation of the sound stimuli, an electroencephalogram is recorded. Then the procedure of averaging over a large number of epochs of analysis is carried out. Usually 100 epochs are used. EEG responses to different stimulus are averaged separately. The responses to the standard stimulus are averaged separately from the responses to each type of deviant stimulus. Mismatch negativity is then identified by subtracting one averaged response from the other. The smaller the discrepancy between the deviant and standard stimuli is, the more similar the sensory responses will be, and as a result of subtraction we will see nearly a baseline. As the pitch differences between the deviant and standard stimuli increase, the mismatch negativity is detected in the subtraction result. This is a negative wave that develops between 100 and 250 milliseconds after stimulus appearance. The shift of potential can be up to 5 microvolts and is most pronounced in the frontal central leads. The more the sound stimuli differ from each other, the shorter the latency of mismatch negativity is, and the greater is its amplitude. The mismatch negativity effect can be observed with the help of stimuli that differ in loudness, duration, and position in space, as well as with different speech sounds. The amplitude and latency of mismatch negativity usually correlate well with the cognitive ability to discriminate auditory information. The better the ability to discriminate auditory signals is, the more pronounced is the mismatch negativity effect. It should be noted that mismatch negativity has its analogs in other sensory modalities as well, and is elicited by any deviances in the repetitive sensory stimulation: visual, somatosensory, and even olfactory. For example, in the case of the visual modality, the mismatch negativity effect can be caused by variations in shape, size, contrast, color, and other features. What are the sources of mismatch negativity generation? The most studied brain processes are related to the generation of mismatch negativity in the auditory modality. Two subcomponents are identified within it: One subcomponent is localized in the temporal lobes, is sensory specific, and is generated bilaterally in the auditory cortex. The second subcomponent is located in the frontal lobe and is associated with activation of the frontal cortex, predominantly in the right hemisphere. The temporal subcomponent is earlier and associated with automatic detection of emerging changes. Activation of the temporal generator reflects subconscious processing of the sensory signal. In 10-20 milliseconds, this generator activates the second source of the frontal cortex, which initiates the process of involuntary switching of attention and an orienting response to the changes that have occurred. Thus, the presence of mismatch negativity reflects the presence of a biologically necessary vital function, warning, which makes the body react with directed attention to changes in the environment. Currently, there are several competing hypotheses regarding the mechanisms underlying the generation of mismatch negativity. According to the adaptation hypothesis, mismatch negativity is the result of local adaptation of neurons at the level of the auditory cortex. With regular presentation of the same sound signals, the neural elements of the auditory cortex become less sensitive, which causes a weakening and delay of the sensory response in the structure of the evoked potential. When a new sound is presented, new afferent elements are activated and a distinct sensory response is generated. In the context of this hypothesis, mismatch negativity is not a separate component of the event-related potential, but the simple result of subtracting one sensory response from another. According to the model adjustment hypothesis, mismatch negativity is seen as a marker of error detection caused by deviation from a learned pattern or familiar auditory context. Naughtonen's early work suggested that mismatch negativity may depend on a memory trace formed by previous stimuli, often repetitive standard sounds. If a deviant or a new event occurs while this memory trace is still active, automatic change detection is activated and mismatch negativity is generated. This period is called the auditory sensory register, or echoic memory. Its duration in young healthy test participants is about 10 seconds. When the time between the presented auditory stimuli exceeds the duration of the sensory memory, the mismatch negativity disappears. Thus, according to the model adjustment hypothesis, mismatch negativity results from comparing the current sound signal with the memory trace of previous sounds. When changes are detected, a corresponding adjustment of the internal model is required, that is, an update of the stimulus representation in the echoic memory. Another hypothesis is the predictive coding hypothesis, which combines the adaptation hypothesis and the model adjustment hypothesis. Mismatch negativity within this hypothesis is described as an indicator of prediction error signals involved in perceptual learning processes. According to predictive coding, perception is created by integrating sensory information from the environment with our predictions based on a model of what caused the sensory response. In this case, current inputs are predicted based on past inputs. In the case of a prediction error, where there is a mismatch between the predicted and actual sensory input, the operation of the neural network must be adjusted, for example, by short-term synaptic plasticity. When subsequent events are repeated, this adjustment is reflected neurophysiologically in the suppression of prediction error and the disappearance of mismatch negativity. Let us now discuss the applications of mismatch negativity. The technique of recording mismatch negativity is used in cognitive research, for example, to study auditory perception, to assess sensory memory, to study attentional switching processes, and to study perceptual learning mechanisms. In addition, mismatch negativity is actively used in clinical research when studying patients with neurological and psychiatric disorders. It is important to note that mismatch negativity occurs regardless of what task the participant is performing. This reaction can be generated even in the absence of directed attention, regardless of motivation and without performing specific tasks. This makes it ideal for newborns, young children, and patients with cognitive impairment. Mismatch negativity can be recorded even in comatose and persistent vegetative state patients, almost reliably predicting return of consciousness. Mismatch negativity is best detected when sound stimuli are presented and can be used not only as an objective indicator of sound recognition, but also to assess sensory memory. This property of mismatch negativity allows us to objectively index the deterioration of short-term memory as a result of aging or brain pathology. During physiological aging without cognitive impairment, there is an increase in mismatch negativity latency. The amplitude parameters may remain unchanged. As the functional status of elderly subjects declines and dementia develops, the mismatch negativity amplitude changes. It becomes lower than in healthy subjects of the same age. In Alzheimer's disease, due to pathologically short memory traces, patients may show normal mismatch negativity at short interstimulus intervals and no negativity at longer interstimulus intervals of 3 or more seconds. This suggests a rapid decay of auditory sensory memory traces in this disorder. Interesting results were obtained when studying the effect of alcohol on mismatch negativity. This effect is dose-dependent. The higher the dose of alcohol, the weaker is the mismatch negativity effect. It is assumed that under the influence of ethanol, preconscious processing of the stimuli characteristics outside the focus of attention is disturbed. In chronic alcoholism, the mismatch negativity amplitude decreases when the interstimulus interval is increased to 2 seconds. This indicates the abnormally rapid extinction of sensory memory. This is what Risto Nautanen said about it.
For normal subjects, from 20 to 60 years, you can see how there is such a mild slope. Mismatch negativity goes down, but not so fast after 20 to 60. But in alcoholics, chronic alcoholics, you can see that this slope is much steeper. This is for a longer interstimulus interval, this is a shorter. So controls here no effect of aging. And here we can see in alcoholics goes down. So we can drink our mismatch negativity away, but you have to drink many vodkas. It's half a bottle of vodka to get this effect.
In stroke patients, a focal cerebral infarction is often accompanied by damage to areas that may be quite distant from the immediate stroke site. This is associated with more severe functional impairment, both cognitive and neurological. In stroke patients, mismatch negativity is significantly reduced in amplitude and correlates with cognitive deficit, making it impossible to use mismatch negativity as an objective indicator for monitoring post-stroke recovery, at a time when other behavioral tests are unavailable. It should be noted that in patients with post-stroke aphasia, a recovery of the mismatch negativity amplitude is closely related to improvement in speech comprehension. Another important application of mismatch negativity is in dyslexia research. In dyslexic patients, a reduction in mismatch negativity is observed only for frequency deviations, but not for duration deviations of auditory cues. This means that dyslexia is associated with impaired auditory frequency discrimination. The reduction in mismatch negativity in children with learning disabilities suggests that the deficit occurs at the stage of auditory signal processing that precedes conscious perception. The most promising clinical application of mismatch negativity is in schizophrenia research. First, mismatch negativity depends on the activity of NMDA receptors. Pharmacological blockade of these receptors has been shown to significantly reduce mismatch negativity in both monkeys and humans. These findings are important because NMDA receptor dysfunction is thought to be a cause of schizophrenia pathogenesis. Second, clinical studies of patients with schizophrenia require very simple paradigms that are robust to changes in attention and performance. And mismatch negativity meets these requirements very well. Several dozen studies indicate a decrease in the mismatch negativity amplitude in patients with schizophrenia. In addition, the mismatch negativity amplitude correlates with the severity of the illness, cognitive dysfunction, and functional status of the patient. It is suggested that the frontal source of mismatch negativity, which is responsible for involuntary attentional switching, is primarily affected in schizophrenia. Perhaps it is the disturbance of the frontal generator that influences the social inadequacy of a schizophrenic patient, making it difficult to involuntarily switch attention to socially relevant auditory cues such as intonation and voice volume, changes in the speaker's voice, or changes from one speaker to another. The software includes several tests for recording mismatch negativity. They're all audio and located in the ERP Neurovisor module. Now these scenarios are added to the favorites, and we can see them at the top of the list. Among these tests is the simplified MMN, a scenario in which standard and deviation stimuli differ quite significantly in pitch, 1000 Hz and 2000 Hz. There is another MMN test where, in addition to the standard and deviant stimuli, there is a distracting stimulus. The scenario we're going to use today is the MMN 5 tones. In this scenario, the standard stimulus alternates with 4 different deviant stimuli. This scenario was developed by Risto Naughton and team specifically for clinical use. Unlike traditional oddball paradigms, this scenario allows for registration of several different responses, rather than a single type of mismatch negativity during the same study. In this scenario, the standard stimulus is the lowest tone, which is a 1000 Hz frequency, which will be presented most of the time in 80% of the presented stimuli. And there are 4 different deviant stimuli that are slightly different in pitch from it, which will be presented randomly, the remaining 20% of presented stimuli. Note that this scenario does not require any behavioral response from the study participant. On the contrary, in order to distract his attention, he is offered either to read an interesting book or to watch a video that is displayed on the patient's monitor. Let's look at the settings that are set in this scenario. In the Regulation tab, we can see which calculation peaks are set by default when detecting different components of the event-related potential. Here you can change the artifact amplitude threshold and also set the calculation segment in which the reference point for averaging potentials is the moment of the sound signal, the tone. This segment includes 200 milliseconds before the reference point necessary for baseline, zero-line correction, and 600 milliseconds during which the sound sensory information is processed and all components of the potential associated with the event are generated. We will not need press the button function, nor will we need a random stimulus delay, because in the MMN scenario, it is necessary to set the same interstimulus interval. In our case, it will be 1200 milliseconds. In the Montage tab, the default setting is monopolar leads for 9 electrodes. Since we want to evaluate the mismatch negativity topography, we will increase the number of electrodes to 19. In the Filters tab, we can set the high and low frequency filters. For our mismatch negativity response, it will be enough to set the high pass filter to 0.5 Hz, low pass filter can be set to 30 Hz. And of course, do not forget the notch filter. According to the ethical rules, before we start the study, we have to ask our volunteer to read the participant's information, which describes in detail everything that will happen and necessarily all the unpleasant and potentially dangerous aspects of the study. After reading the description, the volunteer signs an informed consent to participate in the study. In the informed consent, the participant declares that he has received all relevant information about the study, that his decision to participate is free and voluntary, and that he can withdraw from further participation at any time if he wishes, and that there will be no unwanted consequences for him. After our participant has signed the consent form, we will offer her to take a modified seashore test, which allows to assess discriminative sensitivity to sound signals. In this test, we will present the sound stimuli in pairs through headphones. They would be the same that we will use to register mismatch negativity. For each pair of sounds, the participant must determine which of the sounds is higher and indicate this on the answer sheet. Note that in the seashore test, the participant is fully focused on listening to the audio stimuli. In contrast, when recording the mismatch negativity, his attention is diverted from this task. As we can see, our participant showed a fairly good ability to differentiate between tones when they differed from the standard at 16 and 32 Hz, and had difficulty when the difference between the standard and deviant stimuli was minimal. We wonder if the brain response would be different when listening to the same stimuli in our study. The process of electrode placement has been discussed in detail in previous lectures. Now we would like to draw your attention to the fact that abrasive gel has proven to be very effective. It allows you to reduce the transient resistance between the electrode and the skin significantly and achieve good contact. Before starting the registration, it is necessary to adjust the volume of the sound signals. It can be done in the window with other settings. It's better to start with small values and gradually increase the volume. Also, in this window, note that in the report we will need difference diagrams of the wave responses. This is necessary to detect the mismatch negativity. After making the settings, we can go to the selected scenario window and check how the electrodes are installed. If they are marked green, the resistance is low, and we can go to the EEG viewing window. We press the next button and the signal appears. Then we check the EEG for artifacts. If everything is well and nothing needs to be improved, we proceed to the study. It will consist of 2 parts, the short training part and the main experimental part, in which there will be 500 presentations of different sound stimuli during 10 minutes. Now we will warn our participant and present the sound tones in demo mode. Now all 5 tones will follow each other in the order of their increasing frequency. If the participant can hear sound stimuli well, you can move on to the experimental part. Now the lowest tones, the standard stimuli, will be presented most often. Periodically, they will be interrupted by one of the deviant stimuli, a higher frequency tone. We would like to remind you that our participant does not have to perform any special actions or to focus on these sounds. On the contrary, we distract his attention by showing a video on the patient's screen. At any moment, we can switch from the EEG viewing mode to the averaged responses mode, where all the stimuli presented are marked with different colors and their frequency is indicated. They correspond to averaged responses. Standard stimuli are presented most often. Deviant stimuli appear less often. We can see how many epochs were averaged to identify the responses. If necessary, we can always stop the study by pressing the stopwatch button, or we can double the number of stimuli presented. This is necessary if the number of averaged epochs is not sufficient. Once the study is complete, a PDF report is automatically generated, and we can proceed with a more detailed analysis of the data obtained. Now we see a saved file with a 19-channel recording of the EEG, and it should be noted that there are oculomotor artifacts associated with blinking, as well as the fact that our participant was making eye movements while watching the video. We can remove this component by entering the artifact removal mode. Note that the eye movement component should have an anterior frontal localization near the location of the eyeballs. We find it, exclude it from the analysis, and check that we really removed the oculomotor component. Here it is clearly visible in the original recording. After the correction, we can no longer see it as it was in all the frontal leads. So, if everything is ready, we can save these changes and proceed with the analysis of evoked potentials. Before analyzing the averaged responses, we should pay attention to the order of presentation of the sound signals in our file. It should be remembered that a mismatch negativity occurs when there is a violation of the regularity and another signal appears among the signals of the same type, which differs from them in some characteristics. In our case, it is pitch. In fact, we can see that after a number of repeated standard stimuli, one of the deviant stimuli emerges. On the recording, it is marked by different color. Then there is another series of standard stimuli and another deviant stimulus. The mismatch negativity will not appear if the deviant stimulus appears at the beginning of this sequence, because a certain pattern will not be captured. To switch to the averaged responses mode, select the corresponding menu and we will see the responses for each of the leads. Let's analyze the event-related potentials in one of these leads. Zoom this window to full screen and we can see that there are several components in our potentials. These are the N100, P150 or P200 component, as well as the mismatch negativity and the point corresponding to P300. Let's remind ourselves what these components are. The components that appear immediately after the presentation of a sound signal, developing in the first 200 milliseconds, correspond to the sensory response. This is the N100 component. It appears a little earlier. We can move it to the maximum. It has maximum expression in the central leads. It's negative. The next component is later. It is positive. It has a latency of 154 milliseconds. It is also well expressed in the central frontal leads. Then, between 150 and 250 milliseconds, a deviation begins to form, which is very well defined in the case of the responses to the 1016 and 1032 Hz tones, which differ significantly from the standard stimulus. The 1004 and 1008 Hz tones, on the other hand, show practically no deviation from the standard stimulus. It should be noted that these differences are best highlighted in the difference response, but for this we need to perform additional processing and export our data to Excel. Let's see what the exported file looks like. Each lead is shown in a separate tab. In the first column is the time scale in milliseconds with one step, here specified in digital values. And then there are amplitude values for the averaged potentials obtained in response to the presentation of the standard tone, tone 1004, 1008, 1016, and 1032 Hz. We can independently calculate the difference responses for each stimulus pair by subtracting the values corresponding to the standard stimulus from the values of the response to the deviant stimulus. On the left side of the screen, we see the combined potentials. The green color indicates the response to the standard stimulus, the other colors indicate the responses to the different deviant stimuli. On the right are the difference responses obtained by subtracting one potential from the other. All difference curves are shown in black. It is easy to see that as the tonal differences between the deviant and standard stimuli increase, the mismatch negativity becomes more pronounced. Its amplitude increases and its latency decreases. Since our participant showed a good ability to discriminate the pitch of different sound stimuli, the mismatch negativity is also detected quite well, except for sounds close in frequency. It should be noted that this is not always the case. In some people, the mismatch negativity is well registered, and there are cases where it's not possible to detect mismatch negativity from individual data. Of course, all this complicates the use of the method in clinical practice. How can this problem be solved? First, it is possible to increase the number of stimuli presented, but it will increase the duration of the study. In other case, a so-called grand averaging can be performed. In this case, the individual potentials of the different participants are averaged over the group. This increases the total amount of averaging and helps to detect the mismatch negativity. We can now see the result of such a grand averaging. Both the averaged potentials and the difference responses are shown here, reproducing everything we saw in the individual data of our participant. The different stages of incoming information processing are very well distinguished in the responses obtained. The first stage is related to the passive, unconscious processing of the sensory signal. In the averaged potentials, this process is reflected in the form of sensory components of the auditory EP and characterizes the detection of a sensory event. When there are discrepancies in the sequence of events, mismatch negativity is generated, which is a kind of detector of emergent changes. The processes underlying mismatch negativity and associated with the activation of the frontal generator can lead to an involuntary switch of attention to the changes that have occurred and a transition to the second cognitive stage of sensory processing. The positive component, the P3A potential, is maximally expressed in frontal central leads and is considered as an indicator of attentional switching. To summarize this lecture, we would like to note that the mismatch negativity is a unique electrophysiological index associated with the process of central analysis of sensory information, from the stage of a sensory signal discrimination to its imprinting in the form of a memory trace. Thus, by studying the mismatch negativity, we get closer to understanding how the perception and cognition of the world around us is realized.